Yeah, so I had an elderly patient, elderly gentleman who'd rocked up in A&E, okay, and his presenting complaint. That's always what we ask people when they first come in. It's basically like, why are you here? Which you think is an easy question to answer, right? But a side story, probably half of the patients I see, why are you here? I don't know. Right? And you'd think,
Someone
no,
brought
no,
me here. They left me at the door.
Yeah, no, that happens as well sometimes. But it's like, oh yeah, the doctor was concerned. This is the one I hear, right? And when they say doctor, they mean GP. All right, what was he concerned about? What was she just kind of concerned about? Oh, I don't know. It's like, this is your health, man.
What's
Like,
on the letter?
You gotta be asking questions. Yeah, yeah. Have you got a letter with you? No. Okay. Have you got pain anywhere? Then you just start there. You just like, what's your problem? What's your problem, man? So anyway, this dude comes in, right? So he's an old timer. He's kind of pushing over 70, right? And he's like, oh, I haven't opened my bowels in a few days. So he's not done a poo. Have you noticed that our podcast is
Yes,
coming
I've noticed
around
this now.
wee
Yes,
and
yes.
poo and... No, we need to get away from that. So yeah, last story around this. Just be adding value to people's lives, man.
This is a funny story though. It's adding
is.
value to people's lives.
It is, yeah, adding humour to the day. And she's like, yeah, I haven't opened my bowels. I was like, oh, okay, that's fine. Constipation is very, very common. So, again, being a doctor, guys, the UK diet, right? When I say UK diet, I mean like your traditional UK
English diet.
which is very carby, a lot of chips. It's basically devoid of fibre.
Low fibre. Yeah, low fibre.
Right. Low fibre equals constipation. The number of people I've met who don't know what fruit is, and you think I'm exaggerating, like just don't eat fruit. It's
What,
like,
they don't even understand what it is?
No, it'll be like, oh, I eat fruit if, like, I'm at a wedding and it's like a feature. Like, I eat fruit at the start. Like, there are some people who don't incorporate fruit into their diet at all.
To be fair, I don't have fruit, but I have a lot of veg. So
Okay, fine. Yeah, okay, fine. Same function. I enjoy fruit. You don't enjoy fruit? That's a bit weird. You can like fruit.
no, I get really bloated after having it. Like, I don't mind having it, but it's just, it makes me feel more full than I actually am. Which is great if I have to go somewhere quickly
When
and I
do you eat
haven't
fruit
eaten. Like, normally
If
on
you're
like
gonna
a
eat it?
warm day.
No, I mean, would you... Okay, this is a very Indian thing. So in Indian households...
When my mum cuts it up for me, you mean?
Right,
Gives
yeah,
it
but
me
when
in a
is it
bowl.
given? Before dinner or after dinner? This is the question.
Before dinner, always.
So that is the correct thing, but a lot of people... will
Just
have-
like a way to tie you over until dinner.
Well, actually, it prepares your gut, right? It's saying food is coming. Get
That's a
ready. Yeah,
secondary thing. Yeah,
it should
yeah.
actually make you like a bit more hungry, right?
Yeah.
But a lot of people, they have fruit after dinner as like dessert, which we did for years, man. And then our nani being mum's mom, in India was like, you're supposed to eat the fruit before dinner. Like, that's the way you do it. Game changer, man. Anyway, coming back to the point. So yeah, fruit. Most people in the UK don't eat fruit, don't eat too much veg, a lot of potato, a lot of carbs. And so constipation is just rife, man. Like, the number of people that come in and have kind of abdominal pain, tummy pain, is really, really high. And so, you ask the usual questions. How often do you do poo? What kind of
How often do you normally go? Yeah.
Yeah, exactly. Because again, I kid you not, there's some people like, yeah, I go once every 3 weeks. I'm like, okay, mate.
I've heard some people do that. Some people hold it
Yeah,
in because they
I
don't
know.
like going and they just let it out in one long day. And I'm like, you're nuts, man.
You must be pooing all day, man. But there's some things I'm just be like, okay, you clearly just chatting now. But he was normal. He said I have normal bowel frequency, whatever. There's no blood. And then the next question I always ask is, are you farting? Right? Very important medical question. They'll
Why
explain
is that important?
Right. So imagine the garden hose pipe. Yeah.
Yeah.
Imagine that is your large bowel. So the pipe represents your large bowel.
Yeah.
Now imagine I put a rock in there. Right. Okay. And the rock is now stopping everything above it, i.e. the poo, or the water in this case, coming through past that point. Right? The end of the pipe is your bum, your rectum, that's where poo comes from. So if you have what we call obstruction, right, there's a blockage in your bowel for some reason, okay, and it's stopping the poo coming out, obviously you're like, oh, I'm not pooing, I'm constipated. But then the question to ask is, are you farting? Is it so blocked that even air can't get through, or is air still able to get through? Very important question, because it tells us about the degree and the severity of the blockage, right? If you're still able to fart, good sign. Good sign. Here's the thing. If you're not able to poo, where do you think the poo goes?
It just sticks in your bowel.
Right, and then goes where?
It builds and builds and builds. It expands. What? You throw it back up? Oh,
Yeah, man, it's called
disgusting.
fecal meaning feces, vomitus, vomit. You can actually, yeah, it's making you go now, isn't it? Right. There we go. You wanted medical, baby. I'm giving you medical.
You know
right?
what? I asked for this, so go on. Yeah, tell me.
You did ask for this. This is called fecal vomitus. So you're basically pooing, you're vomiting your poo. So that's not good. Anyway, he didn't have these signs, but his tummy was a little bit soft. A little bit tender. And I was like, okay, so we're going to do a few blood tests. We'll do an X-ray to see any blockages. Are you full of poo and that kind of thing. Part of the examination after feeling the tummy is you use your stethoscope and you listen for what we call bowel sounds, churning, right, to check that the bowel is trying to work. It's trying to push the stuff through. And
just a quick side note, right? How big can your bowel expand to?
Oh, very good question. So it depends on if you're talking about small bowel or large bowel. The small bowel can expand up to 9 centimeters, whereas your large bowel can expand up to 11 centimeters before it goes pop.
Fucking hell. And that's width or length?
No, width. Length, yeah, we never talk about length. It's long anyway, the bowel's very long. But the width, right? So there are certain conditions where, so one condition is called toxic megacolon. It's just huge.
It's not that big.
Yeah, it's big, man. It's very big. And obviously at that point, when it gets to that point, it's at risk of just popping, which we call perforation, which is then life-threatening. You need an operation. You're probably going to die if you don't do something very quickly.
Wow,
so
okay.
a lot of things can happen to the human body, right? Let's just not think about it. Or no, that's the wrong advice from a doctor. You need to preserve your body by doing exercise and eating the right things. Be mindful about what you put in your body, right?
Yes.
That's the thing to think of. So listen to his bowel sounds. And I can appreciate the bowel sounds, but there is this other secondary noise. Bzzz, bzzz,
what the hell?
Bzzz, right, this is vibrating type of sound, right? Like as if there's something there. And I was like, what the hell is inside this man, right?
Like a
And
fly or
the
something?
usual, well, yeah, and you ask the usual questions like, if you anything happened to your bottom, right? Is anything, have you eaten something that's got stuck? That happens. Sometimes people eat things and they get stuck in weird places. I have people come in who eat batteries, and then the batteries get lodged. Yeah, man.
People eat batteries.
Yeah.
Why
like
do you
AA
eat batteries?
Yeah, they're not very well people, the ones that do it. And then I had someone recently who had battery ingestion actually, and then generally they should just move through your bowel and just pop out in your poo. So we had to do what we call serial X-rays, so an X-ray every day to see the movement and see where it is.
Wow.
But if it gets stuck again, then we may need to go in, fish them out.
So when you pass that, it comes out as a full battery?
Yeah, pretty much. Because it's not made to be degraded by the body's
No, it's
juices.
not. The stomach acids ain't going to do shit to that.
Yeah, I don't think it'd be completely intact. I think it'll be but obviously that's worrying, because if that breaks down and releases the stuff in your body, again, big trouble, man. It's the stomach, if when you swallow something, if it's still in your stomach, you can put a camera down and fish it out. Once it gets beyond the stomach, then it becomes hard. Then it's in your bowel, and then you gotta wait till it comes out.
Yeah.
Anyway, so people eat weird things. So we asked him, like, do you eat things? No. Having anything weird? I was like, okay, it's fine. So we did the abdominal X-ray, tummy X-ray, and so here's a bit of teaching about X-rays. So you've had an X-ray before, Indy?
Yo, I don't know. Potentially.
Potentially. Do you remember which part of your body?
No, I do. When I fractured my fifth metatarsal. Yeah, then.
Right, your foot, yeah?
Yeah.
Do you remember looking at your X-ray?
Yeah, I looked at it afterwards. The doctor was a knob. He wouldn't let me see it. I was like, it's my fucking X-ray. Show it to me. He's like, no. Yeah. And I'm like, well, show it to me. He's like, no. I said, I want to see it. He's like, okay, fine. Pulls the screen to me, and I said, right, what am I looking at? He's like, I was like, just show me, man. I've never had this done before, right? I want to feel the novelty. Make me feel special, okay? And he's like, that little line, he said, this tiny line is your fracture, hairline fracture. I said, thank you. That's all I need to know.
That's good, man. I often try and involve my patients. It's patients who take responsibility for their health, are invested in understanding, are less likely to come to hospital, right? Because they will do the right things.
Education, knowledge is power, Dr. Chasman.
Oh, there you go, man. So you've been listening to my stuff, man. Very good. And
who edited your shit for years, you bastard? Right?
Yeah, he knows it all, man. He knows all the secrets. Right, so on your X-ray, what colour are bones?
White.
Perfect, right? And the reason why bones are white in an X-ray is because bones are dense, light comes through, or the X-ray comes through, it can't go through the bone, which is opaque, and therefore you get the image, right?
Yeah.
That's the basics of X-ray. So on this guy, we saw a large white object. So something is just clearly opaque and not allowing, it's not a bone obviously, it's in the wrong place, not allowing the light to go through. Okay? Now, I'm going to leave this to listeners to work out what it is. But essentially, this gentleman had a vibrating large object in his bowel, which had been inserted from his back passage. That's all I'm going to say. And you can work out what kind of a device this is. And I'm sure if you don't know, you can reach out to Indy, who has a particular expertise in this genre of... Indy's really into tech, and this is, I think, an area of his tech
that is hilarious. But every time you tell me that story, it still gets me. So what did you say to him after that?
Yeah, so we'll change the name. Not that I remember the name anyway, but it's like, Mr. Jones, so here's your X-ray. This thing right here shouldn't be there. That's why you're not being able to poo. Right, so we think it's a vibrating mechanical device. Do you remember? You got to keep it PC. Do you remember inserting or sitting
inserting
on
this into your anus? Yes.
Right, from your back passage, and you get the usual response, which is always, "Oh, I fell on it." Right? Everybody's excuse. I don't know how you fall on that. Like you're in the
how do you
position.
fall on it naked? Hang on, let's break it down. How do you fall onto that naked, completely naked? First of all, it has to be in the perfect angle to go in.
This is like, on a landing zone.
Oh man!
Do you know what I mean? Dude, just pause 1 second, yeah.
Go on. Okay, so back again because Karan had to shoot out. So yeah, go on, carry on.
So keeping it PC, sir, Mr. Jones. You got this large mechanical vibrating device, and as you were saying just then, the precision at which the angle at which you have to land on, think of like an airplane landing, like you need to have like signal people like here, right? You need lights.
Oh my god!
This does not happen by accident. That's the point. But again, you can't incriminate, right? This is a very sensitive issue.
Of course you can't.
Somebody of this, and then your mind kind of wanders to, what was he thinking, man? Like, what is it that he was trying to achieve at this delicate age with such a large device?
He probably wanted to know what it felt like.
Yeah. So again,
curiosity,
intrigue, right? Yeah. And then his wife comes in.
He had a wife.
He had a wife. This is pre-COVID, right? And like that conversation, you draw the curtains. The curtains.
You can still hear it. The curtains give you no privacy.
Do you know what I mean? Like, okay, this is hospital, and she's just going in on him. He again, can't remember his name. John, I'll leave you at home for 10 minutes. Come back. You put this up your ass. It's just a funny conversation, man. When it was finally removed, right?
You know what's funny, right? I'm just thinking that must have been there because it was hers.
Yeah, I didn't even think about that ownership. Not sure.
Oh, okay.
When it was finally retrieved and removed, there was a condom on it.
Oh, wow.
We don't know why, but again, his planning and preparation here was full. And
did you give it back to him?
That's certainly one for the for the grandkids, maybe. I don't know.
Did you give it back to him so you could take it home as like a?
Yeah, that's not our property, is it? We don't keep it.
You gave it back to him on one day.
Well, we put it in a bag and then kind of left it on the table, and it's up to you two. You can do what you want with it.
How do you extract that?
Yeah, let's not go into that. But it was extracted. He didn't require an operation. That can sometimes happen.
Okay, so you can pretty much guess how it was extracted then.
Yeah. So that is the medical anecdote for this month. This week.
This week, mate. I love this. We should do more of this, man.